It's almost time for kids to go back to school, and that means it's time to start thinking about germs. Dr. Harkin is here with us from SSM Health today to talk to us about managing, preventing the little germ disseminators out there. Thanks for being with us.
Good to see you. Thank you so much for having me.
What do we got to know here? I mean, it's inevitable, right? Kids are going back to school. There's new germs they're being introduced to.
Absolutely. I mean, the bottom line is this is the time of year when we start getting all the respiratory germs. Yeah. And people, and mainly, most of them are viruses. Okay. The majority of them are viruses. You know, we start with a simple cold, kind of runny nose, stuffy nose, a little bit of sore throat, a little bit of cough. They're mild, goes away on its own. Mm-hmm. When we do start getting a little bit more worried is when it gets to be the flu or COVID, of where, you know, things change a little bit more. Fevers and feeling fatigued and headaches, stuffy nose, sore throat, cough, and body aches. Usually flu or COVID, they come on pretty fast. And so what's important about that is, you know, those are the kids that we're a little bit more concerned about because we do have medicines that we can treat them with.
Sure.
You know, people ask me all the time, what's the difference between flu and COVID? They're very similar, but with COVID, we've noticed, you know, the loss of smell and taste on top of those other symptoms.
Yep. Dr. Harkin, what about prevention? I mean, obviously, you know, some parents might be really concerned when their kiddo starts to come on with something, especially if they're a new parent.
Yeah.
When are we seeking some help from a doctor?
Well, that's a great question. First things first, prevention. Wash your hands, okay? Yeah. Everybody wash your hands. Secondly, yeah, flu shots are a really good deal. Obviously, COVID shots too. But when do they come? I think you come when kids have bad fevers, when they're really feeling fatigued, when they're really just listless, you know, you're feeling crappy. Yeah, that's when you come.
Not good.
And again, it's good when they're feeling that way to kind of differentiate. Do they have flu? Do they have COVID? You know, is it something that we really kind of look closer at?
Sure. When it comes to feeling crappy, how are we thinking about maybe boosting immune systems? Because I'm assuming for little ones, it's maybe not that easy to, you know, give them vitamins, pump them with this, that, the other thing.
Right. Again, and this is, we kind of talked about it just a moment ago, but everybody should get a vaccine. Okay. To me, this is a no-brainer.
Sure.
Okay. Any children over 6 months of age should get the flu vaccine. Anyone. Okay. That's 6 months is kind of the cutoff. But from there on, everybody should get a flu vaccine. Again, small babies, we actually have a mist that you can give nasally. But yeah, flu vaccine's a really big deal.
Okay. Dr. Harkin, we have about 30 seconds here. Any final thoughts for us on kids and germs?
Yeah, one of the big things is also, when you're in a big group, nobody's upset anymore about if you wear a mask.
Right.
Masks work.
Right.
Use them. Take advantage of it. And then if you are sick, and you don't feel well, be nice to your friends. Wear a mask.
Or stay
home.
Dr.
Act
Harkin
even
from
better.
SSM Health, thank you for being with us. We appreciate it.
My pleasure. Thanks so much.
We're back after the break. Stay with us.